Thank you for watching KX News.
Before COVID-19 plunged the world into a global health crisis, an epidemic of a different kind was ravaging communities across America.
But the opioid epidemic hasn't disappeared. In fact, it's only gotten worse. Overdoses and fatalities hit record highs this past year all across the country and right here in North Dakota.
Reporter Maddie Beertemple has more on the worsening problem of opioid overdoses in our state and what law enforcement is seeing on the front lines, leading local in tonight's top story.
Nicholas and Lauren, police in Minot, Mandan, and Bismarck shared shocking data with me over the past 2 years that shows in one case a 6-fold increase in the number of overdose deaths and in another case a near tripling in the number of overdose calls. I also reached out to other police departments across the state, including Dickinson and Williston, who said although they don't have the same level of record keeping as the other cities, they've seen quite a few overdoses too.
Been doing this law enforcement for 28 years. I've never seen anything like what we're seeing now.
In 2020, opioid overdoses were at their highest ever in the country, according to the CDC, and in some of North Dakota's biggest cities.
This is a new trend. This is something that we went from 3 overdose deaths in 2019 to 18 in 2020. And before that, we didn't have any.
That's a 6-fold increase in deaths caused by drug overdoses in Minot. Into 2021, the problem continues.
We've already had several this year. It doesn't seem to be slowing.
In Bismarck, opioid overdoses went from 36 in 2019 to 102 in 2020. Fatalities went up from 4 to 10. And in Mandan, overdoses jumped from 15 to 27. And in Minot, the suspected fentanyl overdose calls went from 28 to 84. Those numbers have kept the Heartview Foundation in Bismarck busy. It's one of just 3 opioid treatment centers in the entire state.
We oftentimes are operating on wait lists because people are calling in for services, and we have more people calling in that we have the capacity to serve.
Jessica Brewster oversees the nonprofit's methadone clinic, which is a medical treatment for people struggling with opioids. She says their services draw patients from all over the state, including rural areas lacking resources.
We absolutely do have people that are driving to us from Beulah, Hazen, Dickinson.
The nonprofit's telehealth options have expanded since COVID, but the efficacy of that is less certain.
They're better than nothing.
A program helping provide opioids education in rural areas recently received $800,000 in grant money. Strengthening the Heartland is a collaboration between both North Dakota and South Dakota state universities to address shortages in services.
One of the big things is like 90% of the counties have a mental health care shortage area. So actually getting this knowledge and resources out to the people within their counties was our goal of this project.
Megan Scott helps lead the project and says it's a struggle for many to simply ask for help.
In small communities, there's also like a stigma. You don't always want to admit that you might need help. And so that's also a problem too of, maybe everybody finding out about it.
While it's well documented, the pandemic is correlated with increases in addiction, alcoholism, and mental health backslides for many. Police say it's hard to attribute current overdose surges to COVID.
I don't think there's a way that anybody would be able to have any indication that it would.
But all 3 did point to a common culprit predating COVID: fentanyl, a synthetic opioid that can be fatal even in tiny amounts.
Now they've introduced these fentanyl pills, which back in the day you'd never seen on the street.
And pills laced with fentanyl are coming in from out of state.
The street names are 30s or blues, and people think they're getting oxys, but they're actually getting, pills that are laced with fentanyl, or they're straight fentanyl.
Often, the pills purport to be something else, but pack fatal amounts of the synthetic opioid.
They're sold as cocaine, but there's fentanyl in it. They're sold as a pill, but there's fentanyl in it.
The deadly drug adds another layer to policing when a user dies from an overdose. If dealers do get tracked down, whether they can be charged for the death is still murky in the law.
It's very hard to get any kind of sentence that hold somebody responsible for the death. It's because you know, in a typical murder case, you have to prove intent. Well, my intent was to deliver drugs, not to kill you.
There's currently a bill in the legislature aiming to address that by having an enhanced penalty for anyone who, quote, sells, distributes, delivers, or conspires to deliver drugs that result in death. It passed the State House 77-19 and is awaiting a vote in the Senate. While changes in law might be coming, changes in policing have already taken place at the departments.
Now we combine our investigators at the PD with investigators from the Drug Task Force so they can use their knowledge of the drug world. We can combine those two teams. It gives us a little extra support from a staffing standpoint.
All three departments say their officers carry Narcan with them, a non-prescription nasal spray that can reverse overdoses. It's sold at CVS, and with that kind of widespread availability, you might expect to see fewer deaths, but the opposite is happening.
Narcan is probably kind of one of those wonder drugs, but it also kind of has a backside to it because yes, it's helping us prevent death in these heroin and fentanyl overdoses, but it also is giving these people understanding that if I do overdose, there's Narcan, you know, it can save me.
Though North Dakota's overdose situation already is bleak, it's still just a small glimpse of the problem because of underreporting. Still, police gave a reminder of the state's Good Samaritan law, which says if you call for help and cooperate with law enforcement, you won't be punished.
If you were there and there's drugs there that were being used and somebody overdoses and you pick up the phone and you make that call, nothing is going to happen.
While the overdose situation in North Dakota doesn't look to be improving quite yet, there are resources willing to help. Go to kxnet.com for links to resources in the state, including Heartview and Strengthening the Heartland. Reporting in Bismarck for KX News, Maddie Beer Temple.